Hello, everybody. This is Dr. Kevin Connors. Welcome to another Holistic Health Hour, where I do my best to answer your questions. So, if you have questions, you can chat them in here on this live call. Or remember, go to holistichealthhour.com and you can ask questions through that. That'll better guarantee your questions get on. And you can see all our past episodes. We got a lot of them now. And they're nicely archived with indexes of what we're talking about, so you can go to anything specific that you want to just, if you have questions about. Also, another gentle reminder to go to our website, connorsclinic.com, because on there we have well over 1,000 blog posts nicely indexed. So if you have a question about aromatase inhibitors, you can find a really nice article and probably an attached video where I've discussed that at depth and given some suggestions. So you can find that all there. Go to our YouTube channel or go to our videos.connorsclinic.com channel. I don't know, 1,200 videos. I don't know what and counting. They're just so a lot of information. Okay, let's jump into your questions. Remember, chat in questions if you can think of anything. First question, I recently developed a canker sore of the soft palate for the first time in my life. It did seem to correlate with stress, but since then I have to avoid coffee, acidic fruits, or it becomes irritated again. Could this be indicating a deeper physiological issue, or could it be just diet related? So what are canker sores, cold sores? What are they? They are herpes virus. Some viruses are just nearly impossible to get rid of. They harbor in our cells, they harbor in our bodies. The oral herpes viruses harbor in the nerve ganglion, the trigeminal ganglion on both sides, and they live there until there's an opportunity. And usually the opportunity is when we get a change of pH in our mouth. So when our mouth drastically changes pH, that gives an opportunity for that virus to come down. What does that? When you suck on a lemon, I mean, that's a drastic acidic change in pH. When you undergo stress, that's a change that changes your pH. So there's lots of different things that change your pH. Some people will say, I get my cold sores when this happens. It just, all the time I can tell that it goes around this time of the month or this time of the year, or when I do this or when I consume this, and I regret it afterwards. So how can you get rid of them? L-lysine is an amino acid that has been proven to help with cold sores. Taking a calcium lactate tablet, you can get calcium lactate just about any store, and sucking on that has helped with some people. Wetting a calcium lactate tablet and dabbing it on the cold sore has helped some people. And then just being aware to try to balance that pH of your mouth where you're not eating acidic foods or something that you notice is irritating that. How do you kill the virus so that it doesn't happen again? Well, sometimes you just can't. I wish I could say, oh, well, you just have to do this, take these supplements, or use the right machine that will knock it out every time. There is no proven way that you're going to always kill this virus. If you do have a right machine, use the right on the herpes settings. That has been helpful for a lot of people too. If you don't have a right, try those other nutritional things and dietary things. It's a tough thing, but once you have that virus, they tend to stay around a long time. They tend to be difficult to get rid of, and you just have to keep them at bay. Question came in on the chat. What can you do for loss of smell after a viral infection? So that has been a common issue with the COVID viral infection. It's a common issue with a lot of different viral infections. Some of the things that you could do to help improve that is there are some supplements that can help stimulate neural growth if there's damage to neurons themselves. Um, but things that are going to decrease inflammation, I think, are going to be your best thing. I would think of antihistamine type nutrition. We have a product called Clear Histamine Scavenger, which covers a lot of the histamine um, checkpoints, because it's not just solely histamine that causes that inflammation. So that would be a good product to think about. There, you know, it's difficult. So viruses are difficult to deal with because there's argument whether they're truly living organisms, or it's there's just a lot of argument and knowledge. Let's say lack of knowledge that we have with viruses. A lot of things are hypotheses about what a virus is and how they function and what they could do to our body. Like I said, with the herpes virus, it's people have tried everything and they seemingly can't get rid of them. All they're doing is knocking it down, keeping it at bay, and keeping it in a state where it's not uh, given an opportunity to flourish. So they are difficult. That's where a lot of people use Rife technology to help with viruses and bacterial infection. We saw a big uptick in the purchase of Rife technology in this last quote unquote pandemic that we had, because it was a great tool to use to help keep your family healthy when there are, you know, thoughts of different infections, thoughts of different pandemics, and possible new pandemics coming down the road. A Rife, having a Rife in your house can be extremely beneficial. But again, there is no magic cure, and Rife certainly isn't a magic cure for any of these things either. So, but I would certainly think frequency technology is just another piece that you could add to the puzzle. Next question. I'm going through menopause and began having hot flashes a year ago. I had COVID approximately 1 month ago, and the hot flashes have worsened, along with fatigue, brain fog, decreased sense of taste and smell. Maybe some of you can share your regimen regarding how you rebuild your system post COVID, but also your regimen during menopause. Um, so, having symptoms of hot flashes during menopause, let's tackle that first. So, the reason why a person has hot flashes during menopause, and some people go through menopause and don't have any menopausal symptoms, why is that? Because what menopause is your ovaries starting to shut down. And your ovaries are your main source of production for progesterone and estrogen. However, if you have really healthy adrenal glands, your adrenal glands will semi make up for the loss of estrogen and progesterone so that you can go through menopause without having symptoms. So, a person that has hot flashes, a person that has, and to the degree that they have symptoms during menopause, really is a picture of the degree of their ill health of their adrenal glands. Because menopause naturally is going to be a, a decreased function of your ovaries. Again, if you have really healthy adrenal glands, you could those are the people that sail through menopause and say, I went through menopause, greatest thing in the world. I don't have to deal with my monthly cycle anymore, never had any symptoms. And other women are like, why do I have all these symptoms? And what's wrong with me? Well, what you need to point to is what makes up for that loss of estrogen and progesterone, at least to smooth that out to a gradual point, because even people postmenopausal will still have estrogen and progesterone. Where is that coming from? Even people that have had a hysterectomy still have estrogen and progesterone. Where is that coming from? It's coming from the adrenal glands. So the adrenal glands never will make the same amount as the ovaries are currently making premenopausal, but they'll make enough to keep you from having these symptoms. And the symptoms are these fluctuations in estrogen. That's what causes the symptoms. And the adrenal glands should keep you, healthy adrenal glands should keep you from these fluctuations. Why does a person going through menopause having hot flashes and they got worse and a whole bunch of other symptoms got worse when they had COVID? Well, you could say when they had an infection, when they had a strep, when they had a high degree of stress, when they went through, a divorce, when they anything that's going to put more stress on your adrenal glands is going to take away from the adrenal gland's ability to produce estrogen and progesterone for you to smooth your way through menopause. So when you're having menopausal symptoms, it's really a function of your adrenal glands. So supporting adrenal glands should be your first thought. How do you support the adrenal glands? How could you, first of all, take a step back? How could you measure adrenal gland function? There is a test called, it's a functional medicine test called an adrenal stress test. It measures cortisol through your cycle of a day. So you want to do this test on a normal day, not on a heavy stress day, a day that you're under enormous burden mentally, but on a day that's going to be fairly normal. Maybe you'd say, well, that's every day of my heavy burden day. Well, that may be true, but you want to do it on a fairly normal day. And the test will give you instructions. It is, you are either doing a salivary, usually it's a salivary sample at 4 different times during the day, and you're marking it down, you're writing on the test tube, this is at 8 a.m., this is at midnight, this is at noon, and this is at 3 o'clock. I think those are the typical times for a salivary adrenal stress test. And you should see the cortisol levels. So that's measuring cortisol levels. There's other tests that you can also get at DHEA level. Now, I'd recommend somebody going through these symptoms, having menopausal issues, is to do the Dutch test. That's a dried urine hormone test for your hormones. And then it also is testing, it's the Dutch Plus, I think. It's also testing the salivary cortisol levels, because then you'll get a picture of your adrenal function and you'll get a picture of your other hormones, the DHEA, which is another hormone released by the adrenal glands, which is a precursor to some progesterone and some of your androgens. And you'll get a measurement of your estrogens, progesterone, all the metabolites thereof, and your androgens, which gives you a good picture of your hormone levels and your cortisol levels. So it gives you a good picture of your adrenals and your ovaries, which can then you can discern the health of your pituitary gland, which is the gland that stimulates all these things. So when a person is, again, going through menopause, their lack of progesterone and estrogen is made up by the health of their adrenal glands. If that is compromised, they're going to have menopausal symptoms. And then if they have an increased adrenal stress from a virus or a bacterial infection or a stressful event or anything else that can compromise the adrenal glands, you're going to have a worsening of those symptoms. So addressing the health of the adrenal glands through testing it would be one thing. And then from nutritional addressing the adrenal glands would be by taking supplements wise, would be taking adaptogens. I'm not a big fan of taking DHEA. I typically only recommend DHEA because it is a hormone. Whenever you take a hormone, you're going to have a negative feedback loop for the hormone production. So if you take DHEA, you're basically telling your adrenal glands that there's plenty of it, so it's basically shutting down the adrenals more. So I typically only recommend DHEA for a very short period of time, and it's only when a person is in absolute complete adrenal exhaustion or fatigue. I'd rather give adaptogens and supporting the adrenal gland function through herbal adaptogens and building up the adrenals through adrenal tissue supplements. I think that's a better way to go. Hopefully that answers your question. Next question. My husband has been prescribed statins after his procedure with 2 heart stents. Which side effects should he look out for while taking statins? Well, really, you want to look out for any possible side effects with taking any drugs and any counter effects between drugs as well. So I always recommend people go to drugs.com and you can search your drug, put your drug in, and they have a free search for side effects. I think that's a pretty good website. You could Google it as well to look for the side effects, and you should maybe print out the different possible side effects of the drug that you have to take and then be looking out for it. They're side effects because they have been proven to occur in people taking the medication. So when drugs get approved, they go through different studies. And in one of the phases of the study, they have to have X amount of people on the drug and they have to record any side effects that the person has had. That's why when you watch these drug commercials, and it might say even early death because somebody died on the study. And it could have been caused from the drug. Maybe they have other comorbidities, but it's just they have to list it. And there's usually a lot of them. That's why they have some, person that was trained in auctioneer school to read that at the end of the commercial. So it is something that you should look up. And we become basically immune to all the possible issues of different medications. And, I think, I don't know if I shared last week or not, but it's something as a practitioner that I have failed sometimes because I don't take drugs. So I forget to ask people, to make that a pertinent question of, oh, you have this symptom. What drug are you taking? Have you looked up the side effects of that drug? I certainly don't have all the side effects of different drugs memorized, nor do I intend to. So I think it's easy. Anything you can look up, you should just do that. I'd go to drugs.com and look those up. I don't know what particular ones that you should be looking for. You should just look for anything that you could possibly have. Also, if you are taking other medication, make sure you look those things up too. And if you can find any drug interactions, because I think on drugs.com they also have drug interaction piece of that search that I would search and look for that as well. Okay, next question. I have gamma MGUS recommendations to keep this stable. So gamma MGUS is a monoclonal gammopathy, which is it's not cancer, but it can be a precursor to multiple myeloma and other blood disorders. Similar to there's other diseases, thrombocytopenia, and other diseases, myeloblastic, myeloproliferative diseases that are precursors to lymphoma, precursors to leukemia, precursors to multiple myeloma, the blood disorders, the blood cancers. So how do you keep that at bay? How do you keep that stable? Well, there is no magic way to keep any of those things stable. You just try to clean up your diet, clean up anything that could be, it's just like any other disease process or collection of symptoms that we call syndromes. Whenever you're having ill health, you want to be digging to the reason why. Many times what you'll find in some of the core reasons why is gut health, inflammation, hidden autoimmune diseases that you never knew you had. So doing some functional medicine tests can be helpful. I've said many of our holistic health hours, many people will go in for a annual physical and they'll get blood work done, but nobody ever goes over their blood work. And they're either that or they're told everything was in normal range, but then they look at their blood work and some things are outside of the normal range. Now, I have a nice little video that explains the difference between what normal lab ranges are and functional ranges. So there's a difference between what is considered a normal range for a lab value and what is considered a normal functional range for a lab value. We use white blood cells as an example. Normal lab range on a white blood cell, every lab can have a different normal range. But typical normal lab ranges in the white blood cell is typically like 4.0 to maybe 11. But normal functional lab ranges should be like 4.5 to maybe 7.5. And if you're at an 8 or 8.5 in your white blood cell count, that's an elevated white blood cell count from a functional medicine perspective. That means quite possibly you're dealing with either a chronic or acute infection that is not being diagnosed. Now, if a person has constant lab values that are outside of that functional range, we'll continue to use white blood cell count as an example. Let's say the last 4 labs they did over the last 2 years, they had, white blood cell counts in the 8s or 9s or something. Well, then that's indicative of maybe a chronic viral infection or something like that has never been addressed. Well, what's the problem with a chronic viral infection if I don't have any symptoms from it? Well, you could have inflammation from it. You have chronic inflammation. Just this chronic low-grade or medium-grade inflammation could cause all sorts of diseases in our body. It can affect how our white blood cells are producing, giving a disease name like this. Can affect also, the list is endless. So going to a functional medicine doctor, getting some labs done, even simple labs that you'd get at a normal physical, a CBC and a complete metabolic panel, put under the scrutiny of functional medicine perspectives and lab values, could give you some very big clues on what else could be going on that you may want to further investigate. For instance, let's use white blood cell count again. So let's say the white blood cell count is elevated and lymphocytes are elevated, giving you clues that you could have a chronic viral infection. Well, is that possibly causing something else? So maybe do an antibody test and you see that this person has self-antibodies to whatever came up positive. Then you do, well, what else is causing inflammation in this body that is causing self-antibodies? You do a biochemical screen or you do a food antibody test and you could come up with all sorts of information. And then you could better treat the patient, better know what could be a cause of a problem with the patient and direct care in that way. Instead of just getting, I struggle with what the practice of medicine has become, and quite often it's the practice of functional medicine has become, is labs being done just to achieve a diagnosis instead of labs being done to find now a course of action to help that person, come back to normality or to the best level of health that they have ability to come to. So our labs and tests are not to be done just so we can, you have, an increase in plasma cells, so we're going to give you this disease name. So now we're going to watch it and we'll finally do something once it turns into multiple myeloma. To me, that's not preventative medicine. All you did is come up with a diagnosis, put a name on it, and again, their hands are tied from a medical perspective. If they're going to use some sort of medicine, it's probably going to be a drug, which may alter the lab findings, but it's not actually fixing the patient. But digging into why that is the case. So how would I keep a pre-cancerous condition at bay? I would dig into why. So I would get into some functional medicine tests, maybe antibody tests, maybe even start by looking deeper through a functional medicine perspective of the CBC and complete metabolic panel that you probably had done on a regular basis, and start looking for clues and give us direction on what other tests should be the next course of action to get to some core things. If you need help with that, you could certainly contact our office through our website, Connors Clinic. You can schedule a case review with me through our self-schedule page. I'm pretty sure I don't have any blog posts on this particular condition, but you can find all sorts of blog posts about cancer that might prove to be helpful on different possible causes of cancer that may be proven to be helpful because things that cause precancerous conditions can be fall into those same categories. Can you reverse varicose veins? Um, no, not really. There are some things that you can do from a nutritional standpoint that can cause give a better tone to venous structure. I can't think of the nutrition off the top of my head um, because it's been so long since somebody asked me about varicose veins. But there is some nutritional um, supplements that we used to use way back a couple decades ago. I think it was a standard process supplement that we used to use. I think it was called Vascular Tone or something like that. Um, that has helped. Nothing is going to reverse it, but you can. It's again, it's a symptom of lots of vascular tone. So I think that's the name of the product. They might have changed it by now, but we use some nutritional product for people who are prone to varicose veins. And I do remember that people were helped by it, but it's not going to reverse a varicose vein. You can see pre-varicose veins when you start to see veins come to the surface. When you have veins grossly coming to the surface and have past the surface, and it's going to be very difficult to really help that. One of my staff just texted me a Premier Research product called Venamend, VENAMEND. That's a Premier Research product that is used for that purpose. Thank you for that. Right. Next question. Are EMFs worse for kids? What can we do to protect our kids? Well, certainly there isn't any studies on this kind of stuff because you can't do studies on kids. But you'd think that the same EMFs that are affecting us adults negatively would probably affect a smaller body in a worse case, especially a developing brain, developing nervous system would have a greater degree of effect on them. There's a limited amount of things that you can do to prevent EMFs. I always suggest that people turn off their Wi-Fi at night. I think we discussed a few of these things a few weeks ago when somebody asked an EMF question. I use a little device called a Hedron on my phone. I also use a phone case that blocks EMFs. And I very rarely put my phone up to my ear. I always put it on speakerphone. I also use headphones like this. These are air tube headphones. These are the ones that we sell at our store. It has these little tubes here. So the sound is carried through the ear on these. So they're basically zero EMF headphones. We sell a lot of these to parents with kids because kids are on, pads and computers and listening to things, and the worst thing you can do is have a Bluetooth device in your ear, and putting your cell phones up to your head is not good for you because you have those EMFs coming from there. So you just take a step back, and where are we getting EMFs from? Well, I'm getting EMFs from this computer here, but if you had an EMF device, measuring device, you could actually measure how much EMFs that computer produces. And I've measured mine. It doesn't produce a lot of EMFs, so I'm not really concerned about that. I actually have a Hedron on my computer right here down at the corner also. And then the other source of EMFs are worse is your cell phones. And external EMFs external from devices that we're using are EMFs that are, your electrical box on the outside of your house. Your cell phone towers are the worst culprit. So there's some things besides moving, or if you live near cell phone towers, what are you going to do? But certainly there's some things like using air tube headphones highly advisable. All my grandkids use AirTune headphones when they're listening to things, so very helpful. Question come in: help with prostate E. coli infections. So, prostatic infections, no matter what they are, if you know that it's an E. coli infection, then you would use nutrients that would boost your immune system to kill that. If if we had a prostate cancer patient with an E. coli infection as well, then we would run the Rife machine on E. coli. If you know what the infection is, and if you have a Rife technology, you can get more specific on what frequencies to run. If you don't know what the infection is, then you can run just a viral program or a bacterial program, and you're hoping to be able to hit it the time. The problem is you're having to run more time to try to hit that frequency. But definitely immune herbs, definitely with prostate, I would use also nutrients for prostatic hypertrophy to decrease inflammation in the prostate as well. We have a product called ProstaClear that has those in it that we use for most our prostate cancer patients and prostatic hypertrophy patients. I would also use berberine with prostate infections and with prostate cancer. That would be a good thing to think about using. And anti-inflammatory nutrients, so the flavonoids like curcumin and boswellia and stinging nettle and quercetin, those kind of things. Next question from the chat: wearable step trackers, smartwatches, body data devices are directly on the skin, constant EMF exposure. What can I do about that? Yeah, those are hard. We are really bombarded with a lot of EMF sources that our ancestors never had, right? So when we wonder why we have an increase in ADD and ADHD and emotional issues and stress issues and anxiety issues and depression issues, all these can be tied to EMFs, at least in part. So it doesn't mean that we don't have other things going on, but when you add EMFs to it's just you're filling your bucket with insults that could affect your health overall. And you just have to start, ciphering through the things that you don't need your kids to use or yourself to use. Do I really need an Apple Watch? No. Is this really improving my life that much? No. It's time to get rid of some of this stuff. What's more important? That you can track your text messages 24/7, or that you're going to prevent possible brain cancer or something like that. I don't mean to scare people, but you have to use wisdom in the risks that you're willing to take being exposed to a greater amount of EMFs. Also, you'll find that people are more sensitive to EMFs if you've had any inflammatory damage to your brain. So I think I mentioned this video last time, and it should be something that everybody really should watch. Go to the website, Connor's Clinic, go to the search button. I have a blog with a video on neuroinflammation. Search neuroinflammation. The neuroinflammation button or blog post has a video on it. It's about a half-hour video. Go through that video. It's half hour of your life, but it could save your family and your friends' life. And the reason is because we can have damage to our brain, causing inflammation in our brain, causing damage to certain cells in the brain, and worse, you developing antibodies to different neural tissue. And when that happens, you're going to be more sensitive to infection, you're going to be more sensitive to EMFs, you're going to be more sensitive to molds, you're going to be more sensitive to all sorts of things. So if you can understand that pattern and ways to calm that pattern down, the better off you're going to be. Now, we have all sorts of different devices that you could use to decrease EMFs. If you go on our store, You can search EMF devices. We have a little wristband that you could wear and a necklace that you can wear that could decrease EMFs. We have grounding sheets that will help with EMFs. We have static brand devices that you can plug into your plugs at home or connect to your um, electrical box that will decrease dirty electricity in your house. There's a lot of different things that you could do to help with EMFs, but if you don't cut out a lot of things, it's going to be difficult. And if you don't address the inflammation in the brain that is causing such ill health with the EMFs, it's going to be difficult. So the more things, the more ways that you can attack this, the better you're going to be, and the better way you're going to be able to prevent issues. Can you send the link for the product offered? Yeah, maybe Dustin can do that. I don't know. So if you go to our store, go to cuttersclinic.com, and here is one link that Dustin sent me. Let's see if I can put it in here. If you go to our store, though, and I don't know if that's sent or not, but there's a link. Yes, that's the smartwatch link. But if you go to that, that'll get you in the store, and then that will get you, then you can search for other EMF products. The Hedron is the little thing that sticks on your phone that helps change the EMFs from dangerous EMFs to not so dangerous EMFs. You could get a large one for your home. You could get one for your laptop. You could get it for different devices that you're using. Then we have a whole bunch of wearable type EMF products. And then go to our ConnorsClinic.com website and just search EMFs. I have a lot of blog posts that will give you some other clues that you don't have to necessarily spend money and do some things that could help. So I'm not here just to sell you stuff. I'm here to give you advice that's going to help you with your health. Sometimes it's just stopping doing some of the things that we're already doing that is going to be your best. That's going to be your best bet. Here's the link to the other things, just the EMF products. All right. Okay, next question that was sent in. Remember, go to holistichealthhour.com after the show, and you can see the other shows, but also that's where you can send in your questions here. So these are some of the other questions from there. I have stage 4 prostate cancer. What would you recommend? Well, that's kind of a loaded question because I don't have like a protocol for stage 4 prostate cancer. So we do cheek swab testing for cancer patients, and then we make recommendations based upon that. And you could have two twin brothers with prostate cancer, and their recommendations could be completely different because everybody's unique. But in general, what should a person do with a prostate cancer? Well, you should do some things that decrease inflammation. But it partly depends on what else you're doing from a standard of care perspective. If you're doing Lupron or an androgen deprivation therapy, everybody doing androgen deprivation therapy, which is, if you're going to follow standards of care with prostate cancer, it's just about everybody that's going to be in that category. You should be doing andrographis. Andrographis is an herb that everybody doing androgen deprivation therapy should be on. Also, EGCG, which is the catechin from green tea extract. Everybody that's doing androgen deprivation therapy should be on that. Now, historically, Lupron, androgen deprivation therapy, will reduce a person's PSA. So if you have PSA of 31 or 12 or 700, it will typically bring that PSA down. It will give you some comfort that, hey, my PSA dropped in half after I started Lupron. But there's question of whether it actually decreases the growth of the cancer or not. If you have to be on Lupron, you want it to work as long as possible. The other issue with Lupron has been that it tends to work for a period of time, maybe a year, maybe 2 years, maybe 4 years, and then it just doesn't seem to work. Well, studies have shown that andrographis and green tea extract, EGCG, increase the time that drug will work. If you're going to be on it, you want it to work as long as possible. Even if you're going to go off of it, being on those two different nutritional products can hold the benefits of that for a longer period of time. Relatively inexpensive thing to do. If you go to connorsclinic.com and search cancer and search prostate cancer, I have lots of articles on prostate cancer with some different suggestions in it as well. But understand, everybody in our clinic is treated as an individual. So I'd highly recommend you do a case review. We talk about it, and we talk about doing possible cheek swab. Next question. My son has Lyme disease. I believe it's phase 3, autoimmune. Okay, so this person has read my information, so that's good. What should he do moving forward? So understand, Lyme disease historically has been acute Lyme disease and chronic Lyme disease. And the separated factor of that is the acute Lyme disease is relatively curable through use of antibiotics. So an antibiotic will kill the Borrelia burgdorferi when it's in the blood and in the tissues. But once the bacteria goes intracellular, inside of a cell, antibiotics won't kill it. And it can reproduce inside the cell, and it can wait for the opportunity. Remember, bacteria, viruses, pathogens are opportunistic organisms. It can wait for the opportunity where it's safe to go back outside the cell, reproduce even more, make a person sicker. And then when your immune system kicks up, it goes back inside the cell, protects itself. There's other avenues that the bacteria has to protect itself, makes itself part of your normal microbiota, protects itself with a waste layer around it. There's other protective measurements that Burgdorferi has. But if it's moved into that chronic phase, and that person has had this chronic Lyme disease for long enough, as your immune system continues to try to kill it, it keeps going inside the cell. There can be a time where your immune system now makes antibodies against your own tissue in the attempt to sacrifice the tissue to kill the disease. So now you have antibodies to self-tissue. So now you moved into what I term phase 3 Lyme. Phase 3 Lyme, by definition, is that you've made antibodies against your own tissue. So now you're really in an autoimmune disease. Now, once you're in phase 3 Lyme, you have antibodies to self-tissue. That Borrelia, let's pretend that the Borrelia came outside the cell, your immune system killed it, and now it isn't even present anymore. So you run an IgM test for Borrelia, and it's negative, meaning you don't have any current IgM antibodies. You don't have any current infection. You do a CD4, CD8 test, you have no current infection. Your symptoms, though, oh, I'm so sick, how could I not have a current infection? I feel so ill, I don't feel well, this has been this way for 8 years since I got Lyme disease. How can you say I don't have a current flare and infection? Well, you could be that ill or worse with an autoimmune disease. Your symptoms are really from the autoimmune disease, from the destruction of self-tissue. And it can be any brand of autoimmune disease, any named autoimmune disease, because an autoimmune disease is named after, it's either a systemic autoimmune disease like lupus, or it's a tissue-specific autoimmune disease like Hashimoto's, or tissue specific to the cerebellum, or tissue specific to myelin sheath cells. So the name of the autoimmune disease has to do with the antibodies that are being produced, self-antibodies that are being produced. So that is what's called phase 3 autoimmune. The question is, how do you treat this moving forward? Well, you have to make sure you're not taking immune stimulants. But the best way is to go to our connorsclinic.com site, excuse my sinuses, and in $50, purchase our autoimmune course. So purchasing our autoimmune course, you'll walk through the steps of really how to treat any autoimmune disease, whether it's originated from this Lyme infection, or originated from mold, or originated from toxins in our environment, or from glyphosates or pesticides of other sorts, or whatever it originated from. It doesn't make any difference. Now that you have self-antibodies, you have to treat this condition completely different. So that course will help you understand how to treat it moving forward. And there's lots of different steps to take. So go through that course. And if you have questions, if you need support, need help, you can make an appointment through a case review as well. Okay, that is, I think, all our questions for today. So thanks for being a part of it. And remind you again, go to holistichealthhour.com. You'll see all our past episodes, and connorsclinic.com, and you'll be able to look at our blog posts and search blog posts. And if you don't think you have Lyme or an autoimmune disease, jump on one of the courses and do the course. We also have a sister site that I continue to forget to mention. It's My Hope for Lyme. My Hope for Lyme has a bunch of information on vaccine injury and chronic Lyme disease and autoimmune disease, and looking at genetics and such. But thanks for being a part of our class today. And remember, ask your questions online through the holistichealthhour.com. Have a great day.